दोस्तों वेलकम टू माय चैनल प्रधान क्रेजी रिसर्च। प्रधान क्रेजी रिसर्च में आप लोगों का स्वागत है। दोस्तों आज का जो टॉपिक है अटेंशन डेफिसिट सिंड्रोम, उसके बारे में बात करने के लिए हम डॉक्टर सुंदर जी हाबू को स्टूडियो पे बुलाया है। दोस्तों आप मेरे हर वीडियो देखते हो, लाइक भी करते हो, शेयर भी करते हो, बट मेरे वीडियो को मैं रिक्वेस्ट करता हूं आप सब्सक्राइब कीजिए। सब्सक्राइब करने के बाद बेल आइकन प्रेस करके रखिए ताकि मेरा कोई भी वीडियो मैं फ्यूचर में डाल रहा हूं तो आपको देखने को मिलेगा। चलिए हम बात करते हैं अटेंशन डेफिसिट सिंड्रोम के बारे में। चलिए मिलते हैं स्टूडियो में। दोस्तों वेलकम करते हैं डॉक्टर हाबू जी को हमारा स्टूडियो पे। दोस्तों जैसे कि आज आपको पता है कि हमारा टॉपिक है अटेंशन डेफिसिट सिंड्रोम। आइए इसको जानकारी के लिए हम डॉक्टर साहब से बात करते हैं। ये क्या होता है डॉक्टर?
अटेंशन डिफिसिट सिंड्रोम बोले तो ए चाइल्ड गोज टू द स्कूल, ही हैज लेस अटेंशन इन द स्कूल फॉर एनीथिंग इज डन इन द स्कूल। वो क्लास में अटेंशन ठीक तरह से नहीं देता है, इसीलिए टीचर गेट्स अपसेट। देन ही डज नॉट डू हिज होमवर्क प्रॉपरली in the school or in the home. So these are all the symptoms which happens in a small child in the beginning of his nursery or in KGs and all. So teacher thinks that child is not doing his homework properly, so he is very dull. Parents सोचता है my child, because every parent want their child to be very intelligent and very useful. But parents also think that my child is not studying properly and the teacher is not teaching properly, so there is a confusion in the child's mind. So he thinks that I am really dull. So this is what happens in a child's mind in the beginning of their childhood. So this is the beginning of attention deficit disorder, which may complicate the matter in the adulthood. This is what is about attention seeking disorder, which we are going to discuss now.
डॉक्टर इसका सिम्टम्स क्या होता है?
Okay. Symptoms बोले तो there are not exactly symptoms, and it is very difficult to diagnose because it is not like diabetes, it is not like any other diseases. Child goes to the school को जाता है first day, second day, third day or first week or first month. There is performance is not there. Child is not interested in the school at all. Child is not interested in studies, and his attention span is only for 10 minutes. Whatever the teacher talks, teacher क्या बोलता है, 10 minutes he can concentrate. After that he is distracted. He is not interested. When teacher tells him to write something, he is not interested. So in the bargain, what happens? Teacher tells the parent that your child is very dull and he cannot cope up with our studies. But actually the problem starts it is not the problem of the child. Child is confused, and sometimes it is genetical also, because there is always one person in the family. There is some attention deficit disorder or dyslexia cases are there. So this comes into the child, the next generation. So it is usually genetical, but sometimes it can be corrected also.
ओके डॉक्टर, ये जो एडीएस है इसका कॉज क्या होता है?
There is no exact cause. It is usually thought that it can come from hereditary, because that's why, as I told earlier, one of the family member can be either a dyslexic बोले तो there is a learning disorder. It is the other form of attention seeking disorder. Attention seeking disorder बोले तो child ठीक तरह से concentrate नहीं कर सकता है. So this is the main cause. And there are, except genetics, there are no other cause. It's not a disease.
So उसको हम डॉक्टर डायग्नोसिस कैसा करेंगे?
Okay. Diagnosis is a very difficult thing in the beginning, because the child is already considered as a dull boy, but which is not a fact. Because there are people with attention seeking disorder who have very successful in life if they are given proper counseling. Counseling means to encouragement from that. For that the teacher has to be trained properly what is a dyslexic or an attention seeking disorder is there. So teacher has to be trained first, and the parents has to give them support. So this is all support from the teacher and support from the parents, support from his friends, which will make him overcome all these attention seeking disorders.
डॉक्टर ये जो एडीएस होता है इसमें उसका ट्रीटमेंट अगर हम दिए तो पेशेंट क्योर हो सकता है क्या?
attention seeking disorder में it is a psychological problem which because it is in the brain. It is not a psychological problem. Their brain, something is wrong in that. So this attention seeking disorder can be controlled or they can overcome that, but there is no permanent cure for this.
डॉक्टर, ये जब ये एटीएस होता है, जो डिजीज किसी को हुआ है, उसको लाइफ में अगर सक्सेस करना है तो वो क्या सक्सेस कर सकता है या ऐसा
100% सक्सेस कर सकता है. For that, as I have told earlier, in the beginning, because child's development start in the early ages, between 3 to 5 years, like that. So in the school, the teacher has to be very supportive. The teacher has to know that the child has attention seeking disorder. So they should not consider the child as a dull child. This is one thing. And the parents has to be very supportive. They should also understand what my child is undergoing. So it is not the problem with the child. The problem is with his brain. It is a genetical disorder. So you have to understand and the supportive therapy. And third thing is they have to go to the psychologist to understand with psychologist for the parents and the teacher. So it is a group discussion how the child has to be tackled. So this is how we have to treat. So only that way the child can come and he become a successful person.
ओके डॉक्टर, आप हमारे दर्शकों को जरा बताइए, अगर ऐसा कुछ पर्सन मिलता है या ऐसा कुछ डिजीज अराइज होता है तो अगर हम उसको ट्रीटमेंट नहीं दिया तो क्या हो सकता है?
Yes, because this attention disorder, if it is neglected, because अभी तो the teacher are also trained in that, parents are also knowing about what is going on in my child, so it can be overcome. So if it is not untreated, it is not treated, child will have stress. He is always confused. He is very restless and he cannot stay in a place for a longer time. He goes on moving here and there. Then in the class it is considered as a disobedience. He is not obedient. But it is not because of his fault, because his behavioral pattern is like that. So he may go into depression. And second thing is, as the child grows in his adolescent ages, adolescent bole to after 16, 17 years, the child may go into drugs, child may go into alcohol. Okay, and these are all the things with the depression, alcohol, drugs may lead into very low self-esteem. तो child समझने लगता है मैं किसी काम के लिए लायक नहीं. So these are the complications which can happen.
ओके डॉक्टर, हमारे दर्शक का ये भी सवाल था कि अगर अटेंशन डिसऑर्डर होता है तो ये क्या हेरिडिटरी रहता है या एक सर्टेन जनरेशन में हो जाता है?
नहीं, 90 to 99% of the cases in this attention seeking disorder, attention deficit disorder, are hereditary. It is a genetical. So either one family before in the parents' family or parents' brother or cousins, someone will be having some dyslexia or attention seeking disorders or some sort of a problem. This is a brain disorder. It is a brain disorder. So there will be someone in the family distant.
ओके डॉक्टर, जरा हमारे दर्शकों को आपने शॉर्टकट में जरा बताइए, अगर ऐसा पेशेंट हमको मिलते हैं तो हम उसको कैसे डील करेंगे?
We don't call them as patient because child is not a patient. Child is a valuable personality. So we have to develop that child into a normal human being. So we don't consider the child as a patient. We consider them as a valuable asset to the society. So we have to make them acceptable and succeed in the society. For that, what is needed is support from the teacher, support from the parents, and support from the parents, friends. All these things. This attention deficit disorder is only support from your school, this one or anything.
डॉक्टर, आप जरा हमारे दर्शकों को बता दीजिए, ये जब ये अटेंशन डिसऑर्डर होता है तो ये कौन से डॉक्टर के पास लेके जाने के लिए उनको अच्छा रहेगा कि ये डॉक्टर के पास लेके जाना है?
First thing is the teacher is the best doctor for a child, and the teacher has to report to the parent that your child is like this. He is not studying, he is not doing his homework. So the parent has to take the initiative to take him to a psychologist or a psychiatrist. So there is no exact methods to diagnose a case of attention deficit disorder. So the psychiatrist, after discussing and after interviewing him so many times with the teacher and the parent, they come to the conclusion that this child is an attention deficit disorder case. So that is the only way of diagnosis. He has to go to a psychiatrist, psychologist, counselors and therapists.
दर्शकों, आपका जो भी अटेंशन डिसऑर्डर में जो भी आपका सवाल था मैं डॉक्टर साहब को पूछ चुका हूं। अगर इससे हटके आपको और कुछ पूछना है तो प्लीज मेरा कमेंट बॉक्स में आइए, कमेंट कीजिए, नहीं तो मेरा डिस्क्रिप्शन लिंक में मेरा ईमेल आईडी है, आप मेरे को ईमेल कर सकते हैं। दर्शकों, अगर आपको ये वीडियो अच्छा लगा तो प्लीज मेरा लाइक कीजिए। एंड आइए हम डॉक्टर साहब को विदाई देते हैं हमारे स्टूडियो से।